Many of us, when we first become pregnant, wonder whether we can continue our exercise routine or to start a new exercise routine for the health of our bodies and our babies. We are learning more and more over the past few decades about the benefits of exercise during pregnancy and prevention of complications. A lot of people think, how much exercise is too much? What's the right amount? Is there anything I should avoid? And the really broad general answer that I give to folks is follow your body's lead. So if you are an exerciser, you're a regular exerciser, you already have a routine, most of the time you can continue that routine. I wouldn't go starting new intense huge goals for yourself. Say if you lift weights or doing big endurance things, you might need to notch it back a little. But in the end, the answer is follow what feels right to you. If it's too much for you, if you're not able, if it feels like it's really, really pushing your limits, then it's probably too much. But if you're tolerating it just well, then your baby is too. There's no magical, what's the max heart rate that I should try to stay below. There's no level above which is dangerous to your baby, but really following what your body is able to do and what feels like too much for you. In the end, err on the side of doing something, staying active. It's going to help to reduce the chances of gestational diabetes and reduce the chances of high blood pressure and help you feeling good through your pregnancy. Sports that have a high risk of impact, like the big examples that you're going to read on every website or even in textbooks, are going to be horseback riding, or really important in Utah, downhill skiing. And I think those are examples that are used to say, if there is a relatively high risk of a big fall that could injure you or cause trauma to your belly, then maybe that's not the activity for you during pregnancy. But as long as the risk of a big injury like that is low, then typically I say it's safe to keep doing. Keep in mind too that there are hormones that our bodies make during pregnancy that can make our joints more flexible. And as our pregnancy develops, our center of gravity can change. And so sometimes there are activities that you maybe could do before that your balance is different and you need to adjust and maybe back off on a little bit, just as your body changes, your balance changes, your flexibility is maybe even more. So there might be a higher risk of injury to joints during pregnancy. So being mindful, being careful, but continuing to exercise and listen to your body is the advice I would give.